You just start IVF. What's normal and not? If you just start IVF and you're feeling bloated, emotional, and wondering what's normal and what isn't, take a breath. What you're experiencing is likely very normal, and we're going to talk about it. So why does IVF feel different? With a natural cycle, your body is only recruiting one egg to ovulate. With IVF, we're trying to get a handful of eggs to ovulate. In order to do that, you're injecting yourself with medications called gonadotropins. These medications recruit multiple eggs to ovulate, and depending on how healthy your ovaries are, you can have a couple eggs ovulating or many eggs ovulating. The more eggs you have responding to the medication, the more bloating you're going to experience, but usually the better your outcome is going to be as well. As the eggs start to develop, you're going to start to feel some bloating. You're going to start to feel some cramping potentially, and you will start to notice in the first few days some mucus discharge. That's very normal. Sometimes the first 5 days or so, you might not experience anything other than irritation at the injection site. You may not notice that your ovaries feel any different. Somewhere between day 5 and 7, you might start to notice some changes to your abdomen. You might notice some cramping, some discomfort, but it may not be the bloating you were expecting until later on in the cycle. Some people worry about emotional swings. The medications that you're taking for IVF may or may not increase your emotional swings because it increases estrogen, which most people feel good on. Oftentimes, those emotional swings happen after the eggs are retrieved and your hormones are declining. However, IVF process itself is very demanding, and trying to keep up with all the injections and the calendar and the appointments, that can increase the stress that you're going through. So plan ahead and make sure that you have the team that's helping you through the process. Most people are going to be on the medications between 10 to 14 days, and during those 10 to 14 days, you're going to be seen by your doctor multiple times for pelvic ultrasound and blood draws. Depending on how you're responding to the medication, you might be seen as often as anywhere 5 to 10 times, sometimes even more frequently. Most of the appointments increase in frequency as you approach the egg retrieval date, and the egg retrieval will be determined based on how your body responds to the medication. Once your eggs are retrieved, people are surprised to learn that you are likely to get more bloated after the retrieval. I always explain to my patients, your ovaries are going to act like those sponges that are flat, and then when you place them in water, they kind of swell up. That's very common. Typically, people experience a lot of bloating after the retrieval between days 3 and 5, and then they start to turn the corner between days 5 and 7. Most people are back to normal by their next menstrual cycle, which happens about 2 weeks after the egg retrieval procedure. These changes or these symptoms that you're experiencing are very normal. Another common thing that people experience after the egg retrieval or leading up to the egg retrieval is constipation, because the ovaries are sitting on the colon and on the rectum, and that can slow down the motility of the intestinal tract. So we do give very strict instructions on how to manage that, and it's important that patients follow their doctor's instructions. One other thing to note is that your doctor is likely going to limit your activity during the process. Each practice has their own restrictions, but this is something you want to discuss with your team. Most people recommend limiting your activity somewhere around stim day 5, and stim day implies when you're injecting your medication as stim day 1. So somewhere in the middle of your stimulation to after the retrieval, at least 1 to 2 weeks. If you started these medications and you're feeling uncomfortable, it doesn't mean that something's wrong. If you found this video helpful, follow us on YouTube and Instagram.